Good morning, doctor. I'm Jessica and I will be your scribe today.
A scribe? What is it exactly that you do? I've been a doctor a long time and I like taking care of people the way I like taking care of people.
No worries. I am here to augment that process. I will make you faster, more efficient, and take away a lot of your stress. When we are done training you, you won't know how you lived without me. Let me educate you. You know how you start off in the morning with a master list of patients that is 20 patients long?
Yes.
I have used MediMobile to make a short list for you that has all your checkout from prior doctors included. It even has 3 small blanks for you to add your billing codes.
I will admit, that sounds wonderful.
I have also printed off the assessment and plan from each of your patients yesterday. You can use this as a reference as we round, to take notes on, and to use as a guide in letting me know what you want in your note, and what you don't. Notes get pretty long and have false information if they weren't edited on a daily basis. I can do that for you and you won't need to navigate the PDoc. You can just think and be a doctor.
Well, let's get started. We have a very busy day ahead. My first patient is a discharge because I always start my day with my discharges first. How can you help me with that?
First, here is the assessment and plan from yesterday for the patient we are seeing to use as a reference. What do you normally do first?
I look at vitals, labs and radiology. Then I review the notes of other providers from the day prior. Then I go see the patient.
Excellent. What would you do with that information as you look it up?
I would take notes on a blank piece of paper so I remember what to talk about with the patient when I am in the room.
Makes sense. Try this for me. Jot notes as you go on the assessment and plan I gave you, instead of using a blank sheet of paper. You can even write comments next to the item they pertain to so that you group them together logically. As you do this, tell me what you are thinking.
Okay. Well, the patient has been febrile, pulse is normal. Respiratory rate is normal, but they had an increase in their blood pressure to 180/90.
Look at the assessment and plan you have and tell me what you would usually do with that information if I were not here. And I mean later, when you are writing your note.
The first problem on the assessment and plan is sepsis. I would make a note under sepsis that the patient has been febrile 24 hours. I would note here that the hypotension had resolved and I would also go down to the third problem, which is hypertension. I would take out the line that said I was holding medications due to hypotension and write that I was restarting the patient's home blood pressure meds.
Sounds good. What would you do next?
Well, the WBC count is normalized, so I would add it under sepsis as well.
Okay. And if you were going to direct me to do that for you, how would you phrase it?
How about, Jessica, add a bullet point under sepsis that says patient's WBC has normalized, consistent with resolving sepsis.
You're on the roll. Now just keep reviewing and talking out loud with the assessment and plan to reference.
This is kind of fun. Let's see. Go under abnormal TSH, which is the problem third from the bottom, and add that the free T4 is normal, so I suspect patient was euthyroid sick.
What was the level of the free T4?
The level was 1.5. The neurologist has signed off as the creatinine is normal now. Wait, I should say, Jessica, please note under acute kidney failure that the nephrologist has signed off as the creatinine is normal. Also, please add a category at the bottom of the note for prophylaxis and note that they are on Lovenox 40 daily. Also make a dispo section and note that case management is working on setting up a sniff.
You tell me.
I'd go see the patient.
Perfect. But let me make a suggestion. When you are in the room, you are likely to listen to the patient's heart and lungs as well as check abdomen and extremities. When you do these things, educate the patient as well to what you are hearing, but add the words you want me to use. Something like Mrs. Jones. Your lungs sound good except for some wet sounds I hear at the bases called crackles. That way you are both educating Mrs. Jones and telling me what to write.
Got it. Let's go. Hi Rick. I am Dr. Drake. I knocked on the way and so I would not surprise you. I will be your hospitalist today. That means I am the general medical physician that is in charge of your care. I see that Jessica has pulled the curtain and shut the door to make our environment more conducive to us sharing information. She has also written my name on the board so you can reference it later. It gets easy to forget the names of people you meet in the hospital. Why, thank you, doctor. I also wanted to introduce Jessica. Jessica is the scribe I am working with. She will take notes so I can focus on listening to you, and not staring at a computer screen while we talk. That would be novel. Most doctors care more about the computer than the patient. Not here. So tell me how you are doing today. Well, doc, I'm in a lot of pain. The infection is gone, I'm told, but when I fell down after passing out, I broke a lot of ribs, my nose, and got a nasty gash on my head. I'm sorry to hear that. Certainly we can work on your pain. So since I last saw you, is your headache pain worse or better? Overall better. Any new issues like chest pain, shortness of breath, calf pain or other issues? Nope, doc. None of that. Is it okay if I examine you now? Sure. Just don't push on my ribs. I won't. Let's see. Your lungs sound good. You still have a heart rhythm that is irregularly irregular. Abdomen is soft. Extremities have trace edema but no calf tenderness. I also notice the bruising on your face is decreased a little. I will adjust your Excicodone to 2 tables every 6 hours. What questions do you have for me? I just can't wait to get out of the hospital and on with my life. Okay, Jessica. Anything I could do differently to make your job easier?
One suggestion. When you are in the room, if you can bring your assessment and plan with you. Use it as a reference so that you are looking at problems in the same order I am. That way you can direct me like we did in the hall if you want me to update or change something. Also, let's go back in the room and do one last thing. At the end of each visit, do a brief summary with the patient. Make it educate the patient and pass on the information you would want if you were on call or picking up the patient in 1, 2, 3 line paragraph.
Rick, I'm sorry to drop back in, but I am learning to use a scribe and she taught me a better way to summarize. She thought you might want to hear the plan in more detail also. Basically, your sepsis, or infection, is gone. Your labs are normalizing and you are making progress, but need SNF to rehab after your extensive illness. I expect you to discharge to SNF tomorrow. In fact, let me write the discharge plan on your whiteboard for you, if Jessica hasn't beaten me to it. Wow, Dr. Drake, you are the best doctor I have ever met. You acknowledged me, introduced yourself, told me the duration of time I would be in the hospital. You explained things well, even coming back in a second time to do so. If you thanked me for coming in, I would think you deserved the highest score on any survey I got. It would be my pleasure. Thanks for coming in and answering all my questions. I really enjoyed working with you.
That was perfect. Now, do a final read-through of the note and edit it so the doctor coming in tomorrow has what they need, and weed out unnecessary things.
Okay. Under sepsis, remove the third bullet down that says the patient is hypotensive today, getting boluses, as that is old news. Under abnormal TSH, take out the part about will order free T4 today as it is back and normal as we discussed earlier. Jessica, what are you going to do with that summary paragraph one did at the end of the visit?
When I log in to enter the codes you have chosen for your billing, I will go into the patient chart tab and will cut and paste this as a note. Then tomorrow, when the new doctor's scribe prints the census coverage report, I will have your checkout. So all you need to do is be available via phone if there are questions.
Alright, so now usually I would take 15 minutes writing a note. What do we do next?
We go see the next patient. You will finish a lot sooner without all the paperwork to do. In the old system where I prep notes, you still had a lot of editing to do, as you would not know what I had updated and what I did not. Under this new system where we work in parallel, you only need to take a minute to read and sign the note at the end of the day.
I am going to like this new system. Taking care of patients without headaches. Let's see the next patient. Jessica, I forgot I needed a Chem 7 on Mrs. Grant. Is this something you can help me with?
Yes. I will pull up Mrs. Grant's note and make a little checkbox with brackets followed by order AM Chem 7. When you are signing off on notes, you will see the checkbox and know that it indicates something you need to do. Most doctors enter orders that will change management after we come out of the room, and I put orders that can wait until the end of the day in a note. This way you don't need a separate notepad to keep a list of orders to write. When we are in the room, just turn to me and say, Jessica, bracket in an order for Chem 7 in the morning under acute kidney failure. That is all you need to serve as your reminder when you read and sign notes.
I like that. I am always forgetting to write little orders. It will be great to have everything in one place. Jessica, what if I need to talk to a specialist? Can you help with that?
Of course. I have not done it before, however. Can I watch you do it this time and then I will know for next time? If you spend a minute teaching me now, it will pay dividends in the future.
Sure. First you look up the number. I will pretend I am a scribe. Hello, this is John and I am a scribe calling for Dr. Drake. He would like a consult. The patient is Miss Jones. The reason for consult is heart failure. She is in room 4480. Dr. Drake's cell is 3035198888. No, I don't have a date of birth, but the patient is 105. Thank you. It's that easy. Most of the time you get a call service and they just ask the questions you need. And sometimes, though rarely, the doctor answers directly and you can just tell them you will get me and then hand the phone to me. And did you say you do the billing?
Yep, you pick the codes and write them down. And I navigate Medimobile. You can also ask me to look up the time of partner documented in a note to help you decide if enough time was spent to bill prolonged services. Just remember to tell me how much time to enter into our note. That number is the total of their note in our note.
Anything scribes can't do.
A couple. We don't interact with patients or nurses. We don't run personal errands. We don't interpret data. We do perform any and all administrative tasks to get you out of the hospital on time and happier in your job.
You were right, Jessica. I never want to round without you again.